Hi, and welcome to the 5-Minute Check-In. Well, it's that time of year again. It's starting to get a little chilly. The leaves are changing color. So that means it's time to talk about vaccination. And to help me in this conversation today, we have two experts. First up, I have Dr. Hana El Sahly, who is a professor of molecular biology and virology at the Baylor College of Medicine. Hana, thanks for joining us.
Thank you for having me.
And back again is Dr. Ankita Sagar, who is an associate professor at Creighton University and our vice president for clinical standards at Common Spirit Health. Ankita, thanks for coming back.
Great to be here.
All right, well, let's start off with the flu. And Hana, I'm going to ask you, maybe give us a little insight. What is happening or has happened in the southern hemisphere? For folks who don't know, we often look down to Australia, New Zealand, see what the flu is doing to kind of anticipate what it might do here in the northern hemisphere. So, Hana, what's the word?
So for this season that just ended in the southern hemisphere, the intensity was moderate, meaning it wasn't a quiet season, but it wasn't one of the worst ones. However, I want to remind everyone that in 24-25, the northern hemisphere had one of its worst seasons, especially here in the United States, where we've had some of the highest rates of hospitalization since a couple of decades. And for infants or for children, we had some of the highest number of fatalities. So the vaccines are here and it's time to be ready.
Great. So, knowing that, translating that for Common Spirit Health and how our providers are going to think about this, what are we saying about recommendations around influenza vaccines?
Everybody should get it one.
I like that. It's so easy, it's simple,
Yeah, it is universally recommended exactly for the reasons that Hana and you just discussed, that the impact on mortality and also disability related to flu is pretty significant.
All right. And there's no algorithms. We used to have in the old days, we used to sit around, oh, if you're over this age and had this and that. It's everyone get the vaccine. Excellent. All right. Next up, RSV. Lots happening in this space in the last few years. A lot of new data, a lot of information came out. Hana, you want to give us a little update on the latest? And maybe we'll turn to you, Ankita, about the recommendations.
Yes, so in the last 2 to 3 years, 3 vaccines against the RSV have come on the market in addition to antibodies for infants.
Sure.
And these vaccines were rolled out into the communities at risk, and the CDC and other academic organizations have begun collecting data on how the vaccines are faring in the community. And what was so exciting is that the vaccines performed just as well as they did on the clinical trials, reducing hospital admissions for those individuals at the highest risks. And these are the infants under 1 year of age and older individuals with comorbidities.
Great. So high impact, great trials, well designed, now following community, similar results. Very exciting. Ankita, what are we saying to folks, both our patients and our providers, about this amazing update?
Right. And I think Hana's beautifully laid it out for us. So when we think about RSV, we really think about those little tiny babies, so less than 8 months. How do we protect them? One is through antibody infusions, which is great, or through the mom. So actually giving the vaccine to mom when she's pregnant and pass.
Nice trial, right? Randomized moms, some got the vaccine, babies did better. Just pretty strong numbers in terms of hospitalizations and amazing, really.
Exactly. So that's our younger population. And then we think about those who are 75 years and older because of their higher risk with complications related to RSV. We recommend across the board, anybody 75 and over should be getting the vaccine. And the question then becomes, what about 50 to 74? So those who have comorbidities or are immunocompromised or are receiving treatment that makes them immunocompromised, they should be also getting the RSV vaccine.
Great. So great vaccine, new research, really reinforcing it. So nice, clear recommendations. All right, let's go to the big conversation, which is COVID. A lot happening and discussions in the media. But let's take a look at COVID as it is today in the community. And Hana, any updates on what we're seeing in terms of infection rates or types of COVID? Anything you can give us a quick update on that?
Yes. So like we've seen in the last couple of years, in late summer, we are seeing a surge in cases. A lot of it is mild, but in individuals at high risk of complications, it's landing them in the hospital. And if the past is any indicator, we're going to have another surge sometime around the holidays or right after the holidays. The vaccines, the strain has been selected. It's expected to work against these strains, and they are ready to be utilized for the preventions of these complications.
Right. Now, a little bit of the complicated part, but after hearing from some of the evidence and the different societies, Ankita, what are we thinking and recommending both for the providers and for the patients?
I think so. Let's just start with a foundational approach, right? COVID vaccine, anybody who would like to have one should receive it because they're safe and they're impactful. Exactly as Hana said, they are customized for what is out there right now, and we can really preemptively prevent a lot of COVID in the community. So anybody who wants it should be receiving it.
Okay, I got it. Good message, clear.
Right. Yeah. But then there's some nuances, and I think that's where the rub really is. So again, thinking about population, right? So our babies, so 6 months to 2 years, we recommend that primary vaccine series because they have no immunity. We need to help them build it. And then those who are on the opposite age spectrum, so those who are above the age of 65 and above, should be receiving their COVID vaccine. Pregnant persons should be receiving it, or lactating persons, because again, mom to baby, we can pass it down.
Passive immunity, visualize those antibodies floating into the baby. Is that right? Hana, did I do that right? Is that good?
Did that right? Yeah.
Thank you. Thank you.
And what gets lost in the conversation sometimes is that after the elders who are, 65 and older, those younger than 6 months have the second highest rate of hospitalization. So let's not forget them.
Got it.
Yeah. And I think that's a great point, which then brings us to that 2 years to 64 years, right? Like that's been a major aspect of discussion. What do you do for them? So if they're average risk or lower than average risk for complications, if they would like a vaccine, they should go and get it. But those who have a higher risk, so if they have comorbidities, are immunocompromised, are on medications that make them immunocompromised, or are in a living situation where they're in the household with somebody who's over 65 or is immunocompromised, they should really be concerned and get the COVID vaccine to protect themselves, but then also their loved ones in that household.
All right, good. So I think we have some clarity here, and I think it's nice to have that so our clinicians and our patients can better understand, what the indications are. So Hana, any more comments on COVID before we're going to switch over to pneumococcal vaccine in a minute, but any last thoughts on COVID?
Nothing additional to iterate.
Okay. So let's talk about pneumococcal vaccine. I know this is one of your favorites, Ankita. So why don't we let you talk about this vaccine and what is our general approach with it and why are you so excited about it?
Sure. I know Hana's going to share why she's very excited about the pneumococcal vaccine, but I think this is my favorite vaccine. And the reason is because it is so effective. And when you think about like the science of vaccines and how it evolves over time, it is the perfect example of how we can do this right at the population level. So right now, the pneumococcal vaccine is recommended, again, for thinking about our babies and our children, right? So they have a very specific schedule of series we recommend. And then we're thinking about those who are 50 and over. This used to be 65 and over, but because of how impactful this vaccine has been, we're now recommending it to everybody 50 and over. And then between that 2 years to 50, those who are at advanced risk for pneumococcal related complications.
Got it. Hana, anything to add to that enthusiasm for this vaccine? How often do we give it?
So the primary series in infants is 4 doses. The elders, as Anka just said, 1 dose now. It's simplified. And I want to point to the public health benefit we've seen with this vaccine. The pneumococcal disease used to cause a lot of meningitis and invasive infections in infants, and the incidence of those diseases have dropped dramatically in our infants since we started using these vaccines.
Yeah. I mean, I remember treating these patients in my residency in the good old days, so
it's
those are
good
good
to hear that a disease used to be in the good old days. That's always an indicator. And then actually, and it has such impact on the community that it lowered the incidence in elders as well, just by giving it to children. And it lowered drug resistance in the bacteria because there's less bacteria to go around in our community. So all in all, a very safe and effective vaccine that had a huge public health impact.
Well, thanks. What a great discussion. We covered a lot of territory. We covered influenza, RSV, COVID, and we finished off with the pneumococcal vaccine. And really appreciate, both of your leadership in this space, your insights as we continue to, listen and hear about the new data, new information, recommendations. We'll be getting back to folks, but really appreciate both of your leadership in this space. And I'll see everybody else at the next 5-minute check-in.